Hi, I'm Jess Seitz with Pain Free Intimacy. I had the honor of interviewing Dr. Carol. Dr. Carol is an author, a gynecologist, and a minister that works to help couples restore their sexual story to work towards sexual wholeness. She's an incredible woman, and we specifically talked about how can we heal our sexual story when we have a more traumatic gynecological experience. And so join me as we talk with Dr. Carol about how we can move towards sexual wholeness despite maybe a not so great past. Well, it is such a joy to get to spend some time just picking your brain a little bit. Would you mind just go ahead and introduce yourself and tell us a little bit more about who you are?
Well, thank you. Yeah, I practiced as an OBGYN physician for just almost 30 years. I dealt with patients in a wide variety of areas. One of the big areas that I focused on was the reproductive endocrinology part, the hormonal part of what makes us women and all of that. Although I certainly did surgery and delivered babies. A few years into my practice, I felt very clearly that God had something unique and additional for me to do. So then I went and got my theological training. And so for a number of years, it was a dual track of medicine and ministry and working with individuals and couples and writing and speaking and podcasting. And then just a little bit ago, I stopped actively seeing patients. So I'm not today actively seeing patients medically because the ministry part of who I am and what I've been doing has just continued to grow. Although the OBGYN part of me is still, very much alive. And I have lots of people ask me questions and talk about these kinds of things because it's part of who we are.
Yeah, it's a huge part of who we are. And I think, at least for me, 'cause personally went through vaginismus and struggled with the gynecologist, but I had two separate categories in my brain for my female body and then intimacy within my marriage. And I had a hard time connecting those. And I think sometimes a lot of clients encounter something similar. And so I love that you have very much a lot of really beautiful experience in both spaces here and has seen the beauty of connecting those and the power that can lead to, and as you say in your book, sexual wholeness. And so that's a lot of what I kind of wanted to focus on is how do we enter into sexual wholeness? Yes, from the sex and intimacy side, but also from this side of like seeing our bodies as beautiful when sometimes a negative gynecological
Yes.
experience help set some tropes in our brain that teach us that
Mhm.
our body is not safe because it's the first experience we have sometimes with something kind of penetrating us is a gynecologist. And then that sets the tone for what else is going to come in. On that, you have a book called Expectations, which I absolutely love and absolutely adore because you address a lot of the mindset pieces and the underlying tones of where are we in our sexual story and how are we pursuing sexual wholeness and what do we need to do to kind of heal and move towards that as God redeems this story. And in that book, you highlight the importance of seeing Jesus as present since the beginning within your sexual story. And so many of my clients, myself included, have faced traumatic gynecological experiences. These appointments have led to pain, feeling out of control, not feeling like their voice was heard, things that we never want to cause a client or a patient to experience, but unfortunately do happen.
Yeah.
And so, what would you say to someone who's maybe experienced that as part of their story? And how could they work towards sexual wholeness and seeing Jesus in an experience like a traumatic pap smear or traumatic gynecological experience? Sorry, that was a long
Yeah.
question.
I think that's really important to put those pieces all together. And one of the things that I am very sure about is that for someone who goes to their first pap smear at whatever such time, that is not your first experience with your female body, your sexuality. So, what did you bring to that first gynecological experience? I think that is rarely talked about a lot, but I think it colors essentially everything about how that experience gets encoded in your mind. If your mom took you when you were, oh, I don't know, 13, 16, maybe younger, and she set it up for you in a way that you went afraid, that was part of it. I also have to acknowledge that huge numbers of young women have experienced sexual harm already, long before they came to their first gynecological exam. And that sets up the neural pathways in your brain and your body, where that first exam almost certainly would be traumatic, even if it was the perfect medical experience. I think what you said, Jess, about, okay, your female body and then intimacy and marriage being separate, no. They're very much together. We are embodied beings. God created us as embodied beings, and you cannot separate one part of you from the other parts of you. So the sexual harm being part of it, what you learned about your body, about sex, about intimacy, whether it was from your mom or there's a whole lot of other places you could have gotten that information. And how you got that information may have been twisted, it may have been traumatic in itself. There was a book written some years ago by Vanderkolk, I think is the author. The Body Keeps the Score, and the body keeps the score, especially in something so intimate. Now, your first gynecological exam and what may have been traumatic there, sadly, is part of that. So it adds, and I think for most people, it adds to pathways that were already set up as difficult and painful. And then you asked about Jesus in the middle of our story. Yes, he has been there at all the points along the way, even in your first time or however many times you've been in a gynecologist's office. But here's what I have experienced from so many women that I have talked with is you don't really let him in. That it's so easy to just keep Jesus at a distance in your mind. Maybe you pray. Maybe you believe, God should have an answer and this shouldn't be the way you feel. And so, God, please fix me. But what Jesus being in your story means is you allow him right in. And that's a lot of the work that I do and so on. And we can talk about that in more details. I've kind of hit some of the big pieces quickly, and I'll just let you take the next stab at it. Just where do you want to go more deeply there?
All of it. Um, yeah, I think I really would like to see how we lean into allow Jesus to enter into this space of healing. Because I think there's a dissonance between, and I am specifically talking with about medical providers here, because essentially a person that we put our trust in, we feel like they should be advocating for our body. And then for some reason, we feel like that didn't happen in our story
Yep.
and our experience. And I'm standing here trying to heal this, but have a hard time seeing God, I was doing what I was supposed to do to be healthy with my body, and it ended up in more trauma or pain. And I think, like, how do we mesh that?
As far as how your body feels about the medical profession, part of me wants to apologize, and I do on behalf of so many gynecologists because sadly, many of them don't have the training or care or heart or understanding or time to walk a young woman through that experience in the way that she needs. And so it ends up being experienced as something that's very dishonoring to a woman's body. And for whatever kind of trauma was there in the past, it just gets reinforced. Where was Jesus in the middle of all of that? I would want to encourage a person who is wrestling with that disconnect to ask him exactly that. Imagine if your gynecologic exam was one of the significant pieces of trauma, imagine Jesus in that office with you. That may be a challenge for a lot of young women to really experience. I could give you some information that would go into your left brain, and I'll say some things, but facts in your left brain don't do very much. It's more the emotional, experiential, sensory heart levels on, the right brain, your heart, neurobiologists. I kind of geek out on some of this stuff because I am a doctor, but neurobiologists tell us that the right brain, meaning the emotional, nonverbal, nonlinear, sensory part of you, is actually the master switch of the brain. So just stuffing more information into your left brain isn't very effective or very efficient at changing you. So that the experiential part is much more powerful and in control, frankly, when those two sides of your brain are in conflict. So one of the ways to kind of help some of that connection is wherever you were hurt, whether it was as a little girl and you were being sexually abused, whether it was finding a friend's or a parent's stash of porn, or whether it was your first time in the gynecologist's office and you experienced physical pain and fear and all of that. Imagine Jesus being in that place with you. Look at his face. Where is he in the room? What would he say to you? Write him a letter. Write him a letter from that younger part of you. Give that younger part of you a voice. First of all, that's just good mental health. But then, as far as your relationship with God and the integration of these disconnected parts of you, that can be a powerful way to help those neural pathways find healing and connection.
I love your description of left brain, right brain, and trying to get those to connect. I think we frustrate ourselves when we dump so much into left brain and think, well, why can't I get past this?
Yeah.
Minimizing the fact that right brain is louder sometimes and more in
Yes.
control.
Yes.
And so I really love how you say, go back into that scene and visualize it and embody that scene, because that's not just like taking the facts from that experience, but it's
Yep.
coming back into your body, feeling it, processing it, and exploring it with curiosity and
Yes.
allowing that to let left brain and right brain kind of work together to piece it out.
Yes.
So
Yes.
thank you so much for painting that so well. And I do love in your book at the end of every chapter, you kind of set the scene for what it will look like to encounter God. And you help to give us a voice to what it would look like to meet God in that moment, and how looking in his eyes would kind of pierce our hearts in a way that builds comfort and safety.
Yes.
Yeah.
Yes.
Yeah. I guess in practical sense. So I guess left braining kind of a little bit here. We do a lot in our program about making the penetrative experience a positive experience in as many ways as possible to prevent re-traumatization and promote safety. A lot of women really want to seek after their health and go to the gynecologist and feel safe there. Do you have any practical tips that clients could maybe do to help prepare for the gynecologist in a way that would prevent that re-traumatization, which is a lot of what people fear? Well, what if I go there and I don't have control and I do get hurt and it sets me back from all the work I've done?
Yeah. First of all, you have agency. And that's what I would want to say to every woman. Much of the fear you feel, you have come by honestly because you experienced your body as not your own. And the gynecologist's office and exam can often set you up to have that feeling of out of control triggered again. But you have the option to say no at every single moment, even during the middle of a gynecological exam. I really want to emphasize that because that really helps the right part of the correct part of your brain be engaged as you are taking care of your physical health with a gynecologist. In other words, you have the right, if you see a new gynecologist for the first time, or a new one, if you don't feel as you are having the initial conversation with them that they are not listening to you, not taking you seriously, you can stop right then and walk out. If when you get undressed and they come back in the room, you don't feel honored and safe, you can say, I'm sorry, I've got to stop. When they touch you, you can say, no, I'm sorry, I've got to stop. Or I can't have that kind of touch. Or some very specific things for the vaginal cervical exam, ask that they use a smaller, narrower speculum device to be able to see the vagina. You can ask for the smaller, narrower one. And if a gynecologist says no, then stop. If you don't feel honored and heard, stop. Uh, Holding onto your agency is a big part of that. Now, if you are with a gynecologist who is caring and wanting to care for, be the kind of person that you need to care for you, I think it is appropriate to let them know that you are afraid. If you've been told you have vaginismus, tell them that. If you have been sexually harmed in some other way, I think it's wise to tell them that, because that can trigger in a doctor the part of their heart that says, oh, I want to care. Remember, doctors are people too. They have better days and hard days, and no doctor, including myself, is ever perfect. So speak up for yourself. It may help, if you choose, to have someone with you, a sister, a friend, a mother, a physical therapist, a counselor. It's fine to say, I need a support person with me. So those are a few of the practical things along the way. Before you go, have in your mind what you are going to think about and what you're going to do with your body. Do your breathing exercises. Do the pelvic muscle tension and relaxation. And I know, Jess, you talk women through how to do that, how to take agency over their body and their breathing. And know the tools that you are going to draw on at that moment, because you're not going to be able to just pull those out of the air. You're going to have to, when the tension level is high in the gynecologist's office, you're going to need those tools well practiced. Have a plan in your mind.
Yeah, and I think going with that, I think it can be hard sometimes to speak up for ourselves. A lot of women I find who have vaginismus have suppressed a lot of things, and in general, we've suppressed ourselves and don't speak up for ourselves, don't advocate for ourselves, don't lean into that agency. And so I really value you sharing that from a doctor's perspective. That would be something that you would want to see from a patient. I think a lot of us are afraid if I speak up or if I say, don't touch me, or I need a break, that we'd be stepping on toes or wouldn't be met with compassion.
And frankly, Jess, who cares? Now, I know that's easy for me to say and much harder for a young woman who's afraid to say, but I really want to say that. Who cares? And here's another piece that the medical part of me wants to step in and just say. Sometimes vaginismus is used as a label, and it may not all be the same thing. And you may have other questions about that, but when I, as a gynecologist, have someone come to me and talks about pain with penetration, I want to take an extended time to find out the details, the minute details. When did you first feel that pain? What was the environment in which you first felt that pain? If there was absolutely zero hint of it before you got married and on your wedding night you felt pain, that's very different. Then, if at 11, 12, 13 you struggled with tampons and then you had infections and then you went to the doctor and it was scary, or if you had an uncle or someone else sexually messing with you and you started having physical body responses, those details are very different and important. If it is pain with intercourse, with sexual intercourse specifically, it's very different. For example, pain on the outside as your husband begins to try to penetrate, very different than pain with deep penetration in the middle of thrusting. Those details matter a lot. And so sometimes in preparing, you may have to get over your squeamishness about using certain words and describing details. Because if you come to a gynecologist and say, I think I have vaginismus, okay, but that could be at least a dozen things we know medically and a whole lot more that may not have a specific medical pinpointed understanding. And there's certainly some cases that we don't have details to understand about. I hope that didn't digress too much, but it's really important when you're talking about some of this pain with getting medical care.
I think you nailed it perfectly. It's kind of a bigger topic than just a general, did you check yes or no to pain with intercourse?
Yes,
Well,
yes.
and I think my question too is, my personal story is I experienced pain with sex for quite a while and didn't always have the courage to speak up about it. But when if the doctor was going through their checklist and said, like, do you have pain with intercourse? I'd say yes. And then it was often would move on to the next question. And it wasn't investigated. It wasn't asked about. And I think some doctors feel more comfortable, others don't feel comfortable. But in that instance, if someone does bring up, I do have pain with sex, and the doctor says like, okay, well, let's check it out. Let's do a pap smear, but then it's not brought up again. Would you encourage the patient to say like, hey, I want to dive into that a little bit more. And I'd like to figure out why I'm having pain with sex. Is that
Mhm.
something that you feel like patients should pursue if a doctor doesn't ask specifically
Yes.
more details?
Yes. And let me also say that some OBGYN doctors know more about these things and are more interested in finding some answers than others. And that's sad, but it's true. So if you see one and you don't feel like you're getting answers and getting heard, then don't be afraid to change doctors. That's one message. But yes, I think it is appropriate to ask some of those questions because it's not all the same. And treatments can vary. There are some things that a medical provider may not be able to help you with, but there are many other things where they can. And you got to get to the details to understand whether it's a medical thing that can be addressed or whether there is some other factor that needs to be focused on.
And so if it's a medical thing that needs to be addressed, then I'm hearing some questions come from clients right now. Do they need to get a pap smear to get that done?
Maybe not.
Okay.
It may need to start with an external exam, which doesn't mean a pap smear. An external exam looking at the labia, looking at the area between the vagina and the rectum, and looking for infection or scarring or some congenital differences in the way the vaginal entrance is formed. You don't need a pap smear for that. It may need an examination. Infections can be diagnosed that way if there is one, for example. Lichen sclerosus is a condition that is usually on the outside that can be incredibly difficult for intercourse, but it is a very treatable thing, and you don't need a pap smear for that. So much of that external vaginal opening, labia, vulva kind of things are appropriate to check out, even if a penetration pap smear isn't okay or possible right now.
And then so I use the term vaginismus a lot, but I do recognize that it's no longer in the DSM and it's not quite a formal diagnosis anymore. However, it does still fill a cultural word that we say for penetration being not possible or sometimes painful. And I know some of our clients have mentioned that they've heard that vaginismus is no longer the official medical diagnosis. And what terminology is now used and why was that change made if you know?
I don't know why the change was made, but I think probably because it's a little more descriptive and quotes accurate scientifically. But the term that is more generally used now is genital pelvic penetration pain disorder. And you don't necessarily have to remember the details of that GPPPD, I think. But the point is, it was, I believe, coined to kind of describe this constellation of symptoms, but it's not a specific, what we call pathological diagnosis. In other words, it doesn't explain what's going on. It's just a descriptive word of this category of pain syndromes, which leads me to also say pain syndromes anywhere in the body, including vaginally, have multiple factors that can play into it. I mentioned previously the body keeps a score, trauma, and all kinds of, I believe, although I haven't seen a scientific study to prove this, that religious messages about sex, that talk about intercourse and sex in a marriage that you saw between your parents or with other people that were close to you, how you first learned about sex itself. That porn that you may have seen, that can create templates in your brain that make the nerves in the vaginal as well as other areas hypersensitive. And so it's not possible to separate body, mind, and soul. It has to come back to we are integrated whole human beings. Not all doctors really understand how to deal with that. And I say that because it's sad, but I think a lot of the women you are dealing with probably are running up against that kind of reality.
I think you nailed it. It's when it comes to pain, there's a lot of layers there. And I think my own personal healing stories, it took 8 years to get past vaginismus and painful sex after trying a million different things. And I was working as a chronic pain occupational therapist at the time. And I realized I think vaginismus is more similar to complex regional pain syndrome than it is any kind of like maybe pelvic floor dysfunction at that point. And it's when I made that link that I switched gears and tried that whole mind, body, soul approach, which is what we do now. Our program is called the Mind, Body, Sex Reset because we are taking the different layers there. But you nailed it. It is complicated. And so I like the GPPP. There's a reason why I still call it vaginismus is that's a tongue tie, but it is a descriptive term. And it is that, like you said, constellation of this chronic pain syndrome that has multiple layers. So it's hard. You don't get to just take a lab sample and diagnose vaginismus or GPPPD. You don't get to do an X-ray and can diagnose this. It's a little bit
That's
more
right.
complex. So now it is an umbrella that, yeah, to get that answer. So
Yes. What I tell people is that there is no laboratory test, or and you kind of said this, there's no laboratory test or other thing that I can do to measure your pain. There's no quantity that I, as a provider, as a doctor, can do to measure your pain as your experience. And we do know that people with any kind of pain syndrome, chronic headaches, regional pain syndrome, fibromyalgia, all of that, there are differences in their central nervous system, as well as differences in their immunological makeup, in the way the nerve sensitivity at the location wherever they are in pain with. There is an almost astronomical correlation between adverse childhood experiences, for example, and various pain syndromes. It doesn't mean a one-to-one correspondence. It doesn't mean a cause always, but are enormous multiple layers here. And I'm so glad that is, that's where you go, because I think without addressing those multiple layers, you're not gonna get better.
where a portion gets better, but not all the way better, and then
Yes.
progresses, and it's just there's always gaps left in the healing story, and we can do better as women to support ourselves and heal, especially in this beautiful space of intimacy that we know the Lord wants to heal. So, I guess sticking with the GPPPD topic, I have noticed, and I think some of my clients have noticed too, that a lot of us in the space, so we do group coaching calls, and so we all get to talk with each other. A lot of us have other things going on, whether that's PCOS or endometriosis or
Yep.
fibromyalgia, chronic headaches. Would you say that there's a link between vaginismus slash GPPPD and other gynecological issues, particularly?
The short answer is yes, because it's a constellation, and I think our talking about the pain syndromes kind of highlighted that. I cannot point to a study that says one causes the other, that endometriosis causes GPPPD, or vice versa, or whatever. But yes, I believe, and this is not the scientific medical part of me, it's the whole person, more um, ministry part of me, that every one of us has a place in our being, our makeup, where we are more vulnerable. For some, it's, headaches and whatever. For some, it may be GI distress. For some, it's pelvic distress. And so I think that's just part of living in the sinful, messed up world in which we come to. And so, whatever part of you is more vulnerable, your immunological system, your neurological system, the organs in that area are going to react to the assault of our world and life in any number of ways. It's like there's a little, cauldron there, and it pops out here and it pops out there, and you hate it. And you wish that part of you would just go away. And yet, no, you really don't. And so it's complicated. But that has sometimes helped me understand what my own body is sensing and dealing with at various times. And maybe that can be helpful for some of your ladies.
Yeah, and I do think like it's similar. The body keeps the score. We add those tallies up in that scoreboard, but it's like our body has a hot spot of which
Yep.
that score gets
Yes.
shown. For a lot of
Hotspot.
us,
I love that language. Hotspot is perfect. Yep.
yeah. So for a lot of us, it's the pelvic floor, at least in my world. But it's just we dump tension there, we dump trauma there, we dump anxiety there, we dump,
Yes.
I ate the wrong thing for breakfast and now I feel it there. And that's just the hot
Yes.
spot which your body communicates it's not happy the most. And so we work through supporting her body so it has other ways to express things that don't result in the hot spot getting too hot. At least is the goal.
Here's something that I have sometimes found helpful too. The part of your body that's unhappy, what might that part of your body say if it had a voice? I
Mm.
think that can be a relatively safe and it's certainly free monetarily thing that anybody can do anytime. If my heart is racing, what is that part of my body saying? If my pelvic floor is 9 out of 10 or 11 out of 10 pain, what would that part of my body say if it could talk? It's not a cure all, but it can be a helpful tool in understanding the whole picture.
And if anything, it allows us to stop and take right brain and left brain and come together inside our body. So it's pelvic floor. What do you need from me right now? What are you trying to tell me right now?
Yes.
And you'll probably get more left brain response, but we have to train to pull out that right brain, I think, in a sense too, to allow that experiential and feelings based kind of knowledge come out of that hotspot, if we want to use
Yes.
that term. I love the connection that you put with that. And like that's why oftentimes, yes, you might have endometriosis, PCOS, pelvic floor stuff, painful bladder syndrome, whatever you want,
Yes.
all compiled together. Throw in some IBS there too, and you got the perfect
Yep. It sure does. Yep.
yeah. Another question I had was, what advice would you give a 16-year-old girl who cannot insert a tampon after 2 years of trying and feels worried and ashamed? I first brought these concerns up with a provider at that age and was only offered something to numb the pain and was told that one day I'd be okay when I tried to have intercourse. I sometimes worry about how young girls, young women can better be supported in their development when they are having these concerns.
Mm. First of all, I'm so sorry to that person who at 16 got dismissed and added to her pain, her internal experience of harm. What I would say is that the way young girls are often helped to understand their bodies and deal with the sensations that they experience, whether it's at puberty or starting tampons, if they want to use tampons or whatever, leaves a lot to be desired. And in itself, that learning process can be harmful and set you up for more harm. One of the first things I'd want to say is that gynecologist did not serve you well. And so you probably need another gynecologist. I think probably one of the biggest things that a young girl in that kind of situation needs to incorporate is agency over her body. She needs to learn what it's like to touch herself, to gain control over her muscles, pelvic floor and otherwise, and listen to her body's feedback. And just with her hands, where she has complete control, start penetration. Now, I know that can sometimes feel very squeamish to a woman who's mixed up with all these thoughts and emotions and whatever. And it may or may not be that's the easiest, but if tampons are consistently a problem and just using your own hands and you're basically doing your own biofeedback when you're on using your own hands. You're training your own nervous system because you can stop and you have a lot more control. You may need to find another gynecologist. You may need to find a pelvic floor therapist in process some of those things. I would hope that young girl had a wise mother, which is not always the case. And again, another thing that I grieve for, to help talk about those things and a very tender and sensitive part of life. I wish I had an easier answer. And I'm not even feeling super wonderful about how I answered that, but that's the answer I have.
I appreciate that. And I think what's so hard about so many of these stories, and I could have pages and pages of just hard things that I think women in this world go through. And
Yes.
the sad reality is we have bodies that, as you've said, are designed by God and they are perfectly and wonderfully made. And then there's brokenness, and then there's
Yeah.
the fall, and then there's just that perfection has been distorted in a sense by all of the layers of what we experience in society and in our lives. And, hopefully, like inserting a tampon goes fine, but when our body doesn't respond the way we need to, what initially kept us from understanding that part of our body well? And so it might be even backing up and realizing I never actually touched myself until it was time to
Yes.
insert a tampon. In fact,
Yes.
that area, I didn't even, it just had always been a weird off the limits kind of zone for me until one day I decided I need to use a tampon. And we expect in that moment to be able to connect easily with a part that's so complicated or has been made complicated in this world. And so I think there's a lot, like you said, there's a lot of layers to this, but I do really love like how you said we need to just get some connection and ownership with our bodies and to be able to understand our bodies better because they are beautiful and they were made wonderfully, but there's been layers that have complicated that relationship with ourself that show up functionally with tampons and sex and the gynecologist and stuff. But those are the functional ramifications of kind of some tropes that have already been laid about how we view our
Yes.
body. Yeah.
Yes.
Yeah.
And I would also just second part of what you said in the sense of how you learned about those parts of your body matter. The names that your mom or dad gave to those parts of your body before you remember learning them. What was the emotional content when you explored that part of your body? Were you hand slapped? Were you shamed? What was the emotional content when the topics of becoming a young woman and approaching puberty and periods? What was the emotional content of the messages you learned around that? That can add a lot, and the body keeps the score. So your pelvic floor responds. If you were told, as I have had some women tell me, I can think of one I have worked with in particular, she was told by her mom that her wedding night was going to be horrific and just keep pushing through the pain of sex as much as you can because eventually it'll probably get better, but it's going to be horrible. Well, wouldn't you dread your wedding night? I just grieve for that kind of thing. That may be one of the more extreme. I'm giving that as an example because those kinds of messages around a tampon can make a big difference.
Yeah. Oh, over 100%. I My own personal story was 6 months before we got married and we were waiting for our wedding night. I had a woman I loved and respected tell me, "You should just go ahead and do it now so that your wedding night isn't full of misery." And I was like,
Mm.
"You want me to sin in a sense to do this now so that night isn't as painful and miserable as you're telling me it's gonna be?" And that was it. And then, of course, wedding night comes and shocker, it
Mm.
was incredibly painful. It is. There's usually little things that are dropped in there that
Yes.
create that bigger picture. And then we're surprised when we're blindsided by like, well, why does it hurt so much? Like, well,
Yeah.
yeah, yeah. Well, Dr. Carol, I do really want to thank you for just spending some time talking, sharing about vulnerable but very important things. If you wouldn't mind just telling us a little bit more about your book and the ministries that you offer so that people can find you and know what you're about.
Well, thank you. Thank you. drcarolministries.com or yoursexpectations.com. DRCAROL ministries.com. That's a hub to get everywhere to the things we do. The book, Sexpectations, is about looking at your story with honesty and compassion, inviting Jesus into the messy places in your story. And when Jesus shows up, things change. So, what does it look like to then find the healing and transformation that you need, regardless of what your particular story has been? And we have a lot of additional kinds of things that go along that. We've got some freebies like articles and quiz and devotional email series and a podcast and videos and all of that. Also, we have our new Sexpectations online digital course, videos and worksheets and guided reflections where you mentioned at the end of each chapter in the book, there's a written out experience of inviting Jesus into your story. Well, we have that in video, audio video form in the course to just kind of make it an immersive experience more than just information. And just, I'd invite people to come and check it out. I love messages. If you use the contact page, it's confidential. It comes right to me. And I love hearing from people. I've really enjoyed this conversation. This has been cool. Thank you so much.
Thank you, Dr. Carroll. We appreciate you and all that you do to advocate for intimacy being the way that God designed it to be.
Many blessings to you and your work, which is so important. Thank you.
Thank you. Thank you.